Hello, my name is Steve Webster. I just want to share my opinion and recommendations of how to get the economy back to work and to prepare for a potential phase two or second round of the pandemic coming back maybe in the fall. So we don't have to take the same steps of shutting down all business, not all non essential businesses, and creating economic hardship again. So I want to share some facts, some research stuff that's been out on the internet and news that have been validated. And hopefully these recommendations will be used at the local, state, federal, maybe in the world sort of thing. I'm sure I'm not the only one who's going to share what I'm about to share, but I just want to be one of those people who care to try to help out as many people as possible. This spreadsheet is something I've been accumulating from a Florida, Polk County standpoint. I live in Lakeland, Florida. So we see some numbers here. I'm not going to spend too much time on this. Currently reported, today's the 9th. If we think there's actually 50% more positive cases out there that we just haven't tested the people, I'll explain that in a second why 50%. The percent change is dropping. See, so the increase is dropping. So even in Florida, it looks like we're coming down from our peak. A positive spin out of 22 million people who live in Florida, 99.88 whatever percent don't have this disease. So that's great news. Hospitalization has been interesting to me. Up until today, I thought when I read in the local newspaper about hospitalizations, I thought that meant currently what resources are used. It's been accumulating. So for a whole month, these numbers are just accumulating of actual hospitalizations. And so they're really not that good for us. It's an indicator of how we're doing, but we really need to subtract out people who have gone home or unfortunately have passed away to find out those resources. Because what we're trying to protect is lowering the deaths and not overwhelming the hospitalizations. So unfortunately, we're not getting data on hospitalizations to help us. But even in the worst case of accumulated hospitalizations, uh, the number of beds available in the state of Florida is fine. There is no problem today. No problem today. Now, I want to get into, I want to leave the spreadsheet and share with you about, let's say, in the fall, if we have a second wave of the pandemic because we haven't had vaccines to vaccinate people. It's possible to have treatments that may be as good as a vaccine. I don't think it's going to be as good, but let's say somewhere close to it. We've seen various treatments out in the on the news, but there's one treatment that's been out there for, from what I understand from the news, 40 some years, is basically if someone acquires a virus like COVID-19 and they get over it, because let's say they had no underlying conditions, that they have antibodies. So if the virus comes around to them again, asymptomatic, no symptoms, it doesn't work. It doesn't get in your system, it doesn't adhere, the antibodies beats it up, whatever. All right. So the more people who have antibodies, the less chance of sharing it to someone else, right? So that's the good news. So what basically happens is it's possible that someone who's had the virus has the antibodies. They can donate their blood. A process occurs, gets the plasma of those antibodies, visits a person in the hospital who may be dying from COVID-19 with these underlying conditions, injects a transfusion, if you will, and from what I've read in some of the or what I've saw in an interview in a couple of TV channels, apparently within like 20 minutes from the transfusion of antibodies entering the bloodstream, it can start killing the COVID-19 virus. So what does that mean? That that person probably won't die now. If you caught it in time before too much of end life, that person probably won't die now. You saved a life. Furthermore, they probably get out of the hospital quicker, freeing up the resources. Because when it comes to overwhelming hospital resources, we want staggerization, right? You don't want everybody going there at the same time. So anyhow, that's basically it. But I want to elaborate on it a little bit more. Um, The 50% line that I mentioned up here of unreported cases is actually good news. So let's go into that just briefly, if I may. Um, I saw a report this past weekend, again, today's April 9th, that um, Iceland tested healthy people. A cruise ship tested everybody on this particular cruise ship, so they had healthy people who were tested. And some city in northern Italy was tested with including healthy people. They found out of those three groups that 50% of the healthy, no symptoms, actually had the COVID 19. So let's now talk about there's two tests, at least two tests. You have the COVID 19 test to see if you currently are infected, testing positive. Once you are healed, antibodies, and you no longer are infected and your symptoms are gone, you have antibodies in your bloodstream. If you take that COVID 19 test again, it will show negative. All right, let's talk about test number two. You can have a COVID 19 antibody test. That is the test kit that should spread everywhere in the world because there's an assumption, or there's actually an unknown. How long do these antibodies in our blood system who've had the disease? How long are they there? The tetanus shot, you need one every, 7 to 10 years, something like that, because the antibodies are no longer there. Other things, maybe a lifetime. They don't know about this, but I think the general consensus is it's probably good for at least 45 days. And that's perfect. I mean, it's not perfect, but it's actually good news. So that means if we use the COVID 19 antibody test, we could test the mass populations, or at least those who are working, let's say, to say, blood test time. Have you had the COVID 19 and maybe not realize it? Or you had a cold and or you thought it was allergies, you actually had the COVID 19. If you were tested that you had the COVID 19 because of the antibody test, then they may politely ask you, would you like to save a life today? Please go to this blood bus or whatever and donate your blood. Then they take it through a plasma procedure, whatever that is over my head, but they can get those antibodies, go to local hospitals to say, who's dying in here from COVID 19? Do the transfusion. From what I saw in a TV interview, it could take as little as 20 minutes for it to start killing the COVID 19 virus. And if they're not too far in your end life, that means they recover, they don't die. The death number is now less because they did not die because of it. So here's my summary of the recommendation for a second wave in the fall. Once we find out that there is a second wave, maybe from the first test, the COVID 19 test, to see if you're actively having it, then alert should go out. Those with underlying conditions should be quarantined, isolated again. But this time the economy is open. Everyone else goes back to work. We have the antibody COVID 19 test, that test number two, and start saving lives who unfortunately do get infected with underlying conditions. So even though they're quarantined, maybe some weird thing happened from grocery store to them. They're hospitalized. But because now, in theory, you have plentiful supply of antibodies, they quickly inject them. Like if you had a snake bite, a quick injection saves your life, sort of things. Similar, I guess. And they can recover more quickly and go home. So that's a recommendation for the second wave. So thank you for your consideration.